So if you just had a hysterectomy or you're about to, or maybe it's even been months or years, and it is so important to know some of the precautions and also the progression of getting back into exercise and knowing what's right to do and what's right for your body. So keep watching and we're gonna chat about that today. So if you're dealing with any uncomfortable symptoms or you're about to navigate this journey into having a hysterectomy and you're feeling a little scared, a little nervous, not sure what to expect, well, don't worry. We're gonna guide you in the right direction and talk today about when you should return to exercise after having a hysterectomy. You will get there, and having the guidance of an expert like myself, I'm a pelvic floor physical therapist. I work with women all over the world who have undergone a hysterectomy and want to get back to exercise. So it's really important to get the guidance of someone that's done that before and how to move on so you can feel like yourself again. So many women are told what not to do after surgery, like lifting heavy items or doing any strenuous exercise or lifting after a hysterectomy. But when it comes to getting back into exercise, there's not a lot of guidance, not a lot of instruction on what to do. So we're going to talk about that today. So whether you had a transvaginal hysterectomy or you had a total hysterectomy with an abdominal incision, we're going to go through some of the biggest hurdles I see of women that are trying to get over and recover, but are not instructed the proper way to go through these steps of recovery and how they can really get back into exercise the safest way and the most effective way. So in the long run, you don't end up with further side effects or any unnecessary complications. I think it's important to note that women are told not to lift anything heavy, not to go up and down stairs too much, doing anything too strenuous or getting back into work. But how do you actually gradually go back into exercise? So having a hysterectomy, going through the transvaginal approach, or maybe you had an abdominal incision. If this is your pelvis, this is the abdominal muscles here in the front that can sometimes be bound down with having some scar tissue there. If you had the transvaginal approach, then no matter what sort of type of surgery you had, it's really important to allow your body to heal and recover, and really taking that 6 to 8 weeks to listen to your body and gradually progress slowly. So I just wanna note that if you're having any huge red flags like redness or swelling along any incision you had, you're having bleeding or increased pain when you try to do activity, then you definitely want to go back and see your doctor. But if you feel like you're progressing along, you're just not sure which route to take, then keep watching this video, and that's what we're going to talk about today, is how to get gradually back into activity and back into exercise. So if you had a total hysterectomy, you had everything removed, whether that's your uterus, your ovaries, you had a total hysterectomy. If you had a partial hysterectomy and just had your uterus removed, then healing is going to be very important and listening to your body. Now, taking 6 to 8 weeks to really rest and recover, you can start back some general walking and stretching exercises gradually, just depending on how your body feels. Now, if you've been cleared by your doctor and you're doing some light and gentle stretches, not a full-blown yoga class, but just some hip stretches, maybe some spine stretches, things like that, that just open up the hips and make you feel just a little more comfortable. You may have some discomfort by your pelvic area or down in your lower abdomen, but allowing those muscles to really rest, recover, and heal, and focusing on rest and nutrition and not doing anything strenuous, that is the biggest thing that you can do to enhance that recovery in the first 6 to 8 weeks. Now, 6 to 8 weeks might not be long enough for some people with their recovery. So I think it's just really important to note if you're having any of those red flags or any of those symptoms, or you feel like you're getting sore or having more pain after you start doing more walking and gradually increasing your activity, then you need to dial it back and just listen to your body. Everyone's going to be very different. If you did have a total hysterectomy and maybe you had an abdominal incision, or you have portal sites in your abdominal area where you have small circular incisions, then you want to make sure that once you've been cleared by your doctor, you're working on some scar tissue mobility massage in that area. Now, I do have another video that can talk about scar tissue mobility massage, some things that you can do after an abdominal surgery. So when you're done with this video, go back and watch that one. It's very helpful to allow the muscles underneath, really your core muscles, to be able to engage when you don't have a lot of adhesions or scar tissue developing in those sites there too. But working on scar tissue is a hidden secret that a lot of women don't know or aren't doing. Maybe you're afraid to touch the incision, but just know if you're putting on any ointment or doing anything to get that incision to heal more quickly and appropriately, then scar tissue work with just your fingertips can be a huge benefit to allowing those muscles to really recover, restore, and repair and get stronger underneath without the risk factor of developing any scar tissue or adhesions. Working on breathing exercises. Breathing is so underrated, and breathing exercises are the key to healing. We give this as a tip when people are dealing with any back pain, pelvic pain, just going back to the basics and working on some diaphragmatic breathing. And what that means is your diaphragm is here at the top under your rib cage. And if you're feeling stressed or you're having any discomfort down in this abdominal area and you end up breathing more with your chest and your shoulders, then getting the air down into this area allows for expansion and retraction of those tissues around in your pelvic area and core muscles and pelvic floor. And this all helps be able to enhance the healing, help that recovery. So going back to some of the basics with lying down on your back, knees bent, you're in a nice relaxed position to start, and you'll take your hands around your rib cage. When you take an inhale, thinking of breathing in through your nose and breathing out through your mouth, you're thinking of expanding the ribs side to side. So we call this lateral breathing, or in Pilates exercise, which is what we do a lot of here, is how we can get that rib cage moving and therefore enhancing the diaphragm and how that is moving and affecting the core muscles and the pelvic floor. So working on those every day, you can do those immediately after. That is something very gentle, and getting back into exercise, that is one of the best things that you can do besides walking, when just gently starting to recover those muscles and help enhance your recovery. So diaphragmatic breathing, work on those about 10 or 15 times at a time. You can do that a couple of times a day. Breathing in through the nose and out through the mouth, diaphragmatic breathing, lateral breathing, also placing your hands over your belly and practicing it there too. So not only here, but here as well, and feeling the rise and fall of your abdominals when you are on your back with your knees bent. So those two can be very effective to help recover those muscles. Now, the best thing that you can do is going to see an expert, consulting with a pelvic floor physical therapist. And that's something you can Google in your area, how to find a pelvic floor physical therapist. Many times your doctor won't tell you to go to this person, but it's highly effective to enhancing your recovery, especially if you're an active person and you want to get back into activity. Now, if you don't have someone in your area, we have an amazing program to help women and guide them in the direction of recovering their body. I have developed an online program for hysterectomy recovery and taking you through videos and tips and guidance to get you on the right path to feeling like yourself again. So make sure you check out the link in our description below of how to access that program too if you don't have a pelvic floor therapist in your area or have trouble accessing it. This is a great tool of something you can do in the comfort of your own home too. Now, I think it's important to note if you've started some walking and you started doing some exercise and you find you just want to take a check on how you feel the next day. Now, whatever you did the day before, it's going to either make you sore, stiff, maybe a little pain, or developing any symptoms that could be side effects. So if you feel fine that day after that you've done a little bit more walking, you can gradually increase that. So maybe add another 5 to 10 minutes on your distance, the amount of time you're going out, and again, listening to your body. So if you're feeling fine, then I would start maybe adding in a little bit of an incline, a little bit more strenuous activity to get your heart rate up. But if you use that 24-hour marker of seeing how your body feels the next day, that can be a great marker for knowing when is best to progress your exercise. Now, moving into some strengthening work, although the breathing exercises are the key point to starting first with connecting to those muscles, then you want to start connecting with your pelvic floor. And I find that many women don't know if they're doing any sort of Kegel exercise, if you ever heard of that, or contracting your pelvic floor muscles and allowing them to relax. But doing this with your breathing, I'm going to show you a little bit of a tip to do with that. But this is something we describe a lot more in this recovery program that I have. But this can be highly effective for preventing any pelvic organ prolapse, preventing any leaking bladder-related issues that can come up after a hysterectomy. So you want to make sure that you're connecting your brain with those pelvic floor muscles. And if you think of inhaling and you staying nice and relaxed, and then exhaling, thinking of pulling in through the vaginal area and tightening those muscles, and thinking of pulling in and up on your exhale. You practice that 5 to 10 times, and doing that, you don't have to do it all day long, but just a couple rounds a day of syncing your breathing with your pelvic floor contraction. That can be highly effective for getting those core muscles to restore and connecting with your pelvic floor again, so it can do its job to support your pelvic organs and help with any pain relief as well. So I hope you learned something from this video. If you have questions about your recovery, I invite you to put it in the comments below. Would love to help. And check out that link to our online hysterectomy recovery program. It is so helpful for women all over the world who don't have access to a pelvic floor physical therapist. And thank you for watching. I hope you subscribe to our channel, Level 4 Women's Health, for more tips and videos to help you feel your best as you are a woman aging and want to get the most out of your exercise and your activity level. Thanks for watching.